Hello students, this slide will talk about acute heart failure. First, let's review about heart failure. Heart failure is a group of symptoms caused by abnormalities in the heart's structures, such as the myocardium, valves, pericardium, or blood vessels in the body or lungs, or abnormalities in the heart's function. Such symptoms include shortness of breath, easy fatigue, pulmonary edema abnormal from the left side, swelling of the arms and legs, and neck veins engorged abnormal from the right side. As shown in the picture, heart failure can be divided into two types, chronic and acute, depending on the duration of symptoms. If it occurs gradually and lasts for a long time, it is chronic. If it is acute, symptoms will occur sudden and quickly. The acute phase will happen in a patient who never having had any symptoms of heart failure before, called de novo heart failure. In most cases, the symptoms are chronic and get worse, called acute decompensated heart failure AHF. Acute heart failure, either de novo or AHF, is caused by several precipitating factors that induce left ventricular dysfunction. Diastolic dysfunction is the heart muscle cannot relax to accept blood. Systolic dysfunction is the heart muscle decreased contractility. Both dysfunctions cause backward defect to pulmonary congestion, which results in right ventricular dysfunction and fluid retention in the body. As shown in the figure, diagnosis for heart failure consists of history taking about symptoms such as shortness of breath, difficulty breathing, swelling, anorexia, and abdominal distension, which indicate fluid retention in the body. Physical examination includes a positive test for swelling, looking for neck vein engorged, listening to the heart and lungs. Monitor oxygen set. Arterial blood gas to detect respiratory failure from pulmonary edema. Special investigation will be chest X-rays, echocardiogram, blood testing for BNP or NT-proBNP values, which can help identify acute heart failure. The diagram will summarize the diagnosis of acute heart failure, starting from symptoms and signs, then performing various special investigation to detect the cause and function of the heart, such as electrocardiogram, echocardiogram, and using BNP or NT-proBNP test to specify the diagnosis. Management and caring for patients with acute heart failure include identifying the cause and triggers, assessing the clinical condition, and providing therapy and caring. The management focuses on ensuring the adequate hemodynamic, correcting the causes or trigger, and finally providing care for the patient and family to self-care at home. History taking to find out the cause and triggers of acute heart failure. It can divide into abnormalities from the heart and blood vessels itself for external factors. Internal factors include cardiac arrhythmias very slow or very fast, hypertensive crisis or ACS. External factors are medication non-adherence, salty food, excess fluid, infection, anemia, lung disease, hyperthyroidism, abnormal adrenal glands, taking some toxic agents such as medication, alcohol or addictive substances, etc. Clinical assessment uses two principles: water retention in the body, congestion, or dry to wet, and tissue perfusion, whether good, warm, or cold, using the results of the physical examination to assess in 4 channels. 1. Dry and warm indicates that the patient can adapt. 2. Wet and warm indicates that there is excess water but the blood is sufficient to nourish the body. 3. Dry and cold indicates that there is insufficient blood to nourish the body but there is no excess water. 4. Wet and cold, the most dangerous, indicates excess water and insufficient blood to nourish the body, causing shock. The left side shows the assessment of narrow pulse pressure in cases of low blood to help assess perfusion. Nursing care for patients with acute heart failure requires immediate treatment. We will talk about it in the next slide. If you have any questions, please feel free to ask via email or line.